Hello, we'll go ahead and give everyone another minute or two to go ahead and get connected, and then we'll get started. Thank you. Hello, and welcome everyone to our third annual Data Privacy Day. I'd like to thank you all so much for joining us virtually. My name is Mike Shapiro, and I'm the Chief Privacy Officer for the County of Santa Clara. And we have a wonderful event lined up for you today. Together with County Supervisor Joe Simidian's office, I'm honored to be hosting our event on the topic of modern contact tracing for future pandemics. This area not only relates to work that we're doing right here at the County of Santa Clara, but applies to so many other places around the nation and globe in our collective effort to manage and overcome the current pandemic, which has caused devastating impacts to so many. I'd like to acknowledge the incredible work of Dr. Sarah Cody and her team at our Public Health Department, and to those here today who may be working diligently to try to see our way through this crisis. And so I also want to recognize those who have been impacted by the current pandemic in our community and yours, and the effects it has had on their lives. You know, as we've discovered over the past year, a variety of approaches may be engaged to mitigate the impacts of health pandemics. One way to do just that is by tracking and tracing the path of a pandemic, understanding the patterns it traverses, who has been infected, where they've been, and who they've come in contact with. Historically, contact tracing has been deployed to assist in this work, from smallpox control to the more recent SARS epidemic. With the coronavirus of today, experts are once again focusing on contact tracing as a central pillar in combating and containing disease transmission. Technology can play a significant role in contact tracing, and that is why our event today will be focusing on some of the more recent developments in these technologies that have the potential to augment traditional approaches to improve outcomes in future pandemic response. The topic is important and timely because modern contact tracing technologies, coupled with this dramatic expansion of data analysis and tracking capabilities available to both public and private entities, raise several questions related to the capabilities of these tools and individual privacy that will arise when responding to pandemics in the years to come. So I want to take a moment to briefly discuss our program before I introduce our first speaker. To start off the day, County Supervisor Joe Simidian will provide opening remarks for our event, and we will have two panels with a wonderful lineup of experts across public health, privacy, and technology, who together have years of experience that they can bring to bear and offer what we hope will be invaluable insight. Our first panel will help cover the fundamentals of contact tracing for both traditional methods as well as new technologies. There'll be a brief Q&A session and break to follow before we begin our second panel discussion, which will dive into some of the more complex questions on the privacy impacts of modern contact tracing in dealing with future pandemic response. So if you have questions during these panels, please use the Zoom Q&A feature, where your questions will be provided to our support team and panelists, and we'll do our best to address them for each panel or respond afterwards. As I mentioned, we're privileged to be hosting the event today in collaboration with the Office of County Supervisor Joe Simidian, and I would like to take a moment to introduce him for opening remarks. Supervisor Simidian represents the 5th District at the County of Santa Clara, and his public service over the years includes terms as a member of the California State Senate, the California State Assembly, Mayor of Palo Alto, President of the Palo Alto School Board, as well as an earlier term in the County Board of Supervisors. He's been a champion of privacy rights during his long tenure of serving the public, including spearheading the creation of the Privacy Office at Santa Clara County, as well as numerous privacy laws at the state and local level. His legislative record related to privacy is well known by those in the field and includes California's data breach notification law and online privacy protection law of 2003. While in the California State Legislature, he served as chair of the Senate and Assembly Select Committees on Privacy. On the Board of Supervisors, he serves as the chair of the Health and Hospital Committee and the vice chair of the Housing, Land Use, and Transportation Committee. So without further delay, I would like to now introduce County Supervisor Joe Simidian.
Thank you so much, Mike, and good morning to you all. As Mike indicated, I'm County Supervisor Joe Simidian, and along with our Chief Privacy Officer, Mike Shapiro, and the county's Privacy Office, I want to add my welcome to you all for Santa Clara County's 3rd annual Data Privacy Day. We have really an exceptional program lined up for you today, and I'm delighted that you could all join us today to discuss the somewhat wonky topic, modern contact tracing for future pandemics, balancing utility and privacy. But first, let me just take a moment to explain why I am the one who's welcoming you to today's event. As Mike mentioned, among my other duties on the Board of Supervisors, I serve as chair of our county's Health and Hospital Committee. And that's given me, I think, a particularly close-up perspective on the political, logistical, medical aspects of the pandemic and the pandemic response. As Mike also mentioned, I have a long tenure on privacy issues dating back to my days in the California State Legislature, chairing the select committees on privacy. And so that has informed my thinking and approach to almost every issue I encounter. I'm always looking at it through a privacy and data security lens. Coming back to the Board of Supervisors 8 years ago now, we had a great many opportunities to put our privacy values into action here at the county. As Mike mentioned, the very creation of the Office of Privacy. We are looking at issues like surveillance through a privacy and data security lens, our election security issues, obviously. And of course, the question always is, if we're focusing on the implications of advancing technologies, how do we balance their facial benefits with the more subtle societal costs? And again, could be surveillance, could be election security. In this instance, of course, we're talking about today's conversation around the pandemic response. I think one of the things we've all observed over the years is that while Californians and Americans certainly say they value their privacy and their privacy rights, in moments of crisis, privacy considerations can take a back seat. And I think that's understandable. In those moments of crisis, people say, look, the crisis we face is here, it's now, it's tangible, it's threatening, and our privacy rights may seem remote, abstract, sort of intellectual ephemera, if you will. So that brings me back to the panels we've got today. And as I'm sure all of you can deduce from the fact that you're looking at us through screens rather than sitting in our county board chambers, even Data Privacy Day has been altered by the times in which we find ourselves. At the risk of stating the obvious, the COVID-19 pandemic has affected every aspect of our lives. And now, more than 10 months in, I think we've learned a lot, not just about the pandemic, but about how we can and should respond to events like this in the future. And while the crisis of the moment demands our attention, and while none of us want to anticipate going through something like this again, I think the hard reality is we not only have to do that, it's absolutely critical that we do that. Because of all the lessons that the pandemic has taught us, one of the most important has been the power of what some refer to as the three-legged stool of protocols and procedures that protect us from the spread of the disease. Isolation, including masking and distancing, testing, of course, and then contact tracing, the subject of our conversation here today. These protocols, along with other efforts like basic hygiene improvements, have been well understood and implemented in previous pandemics in one form or another, not just for decades, but in some cases centuries. But as we've seen here in California, throughout the state, throughout the nation, and I would argue across the world, it's important to remember that the jurisdictions that have had the most success in controlling the pandemic are also the jurisdictions who've deployed robust isolation, testing, and contact tracing. Now, while the methods for isolation and testing have remained in some respects largely the same for a very long period of time, recent developments in technology have the potential to dramatically change the way we conduct contact tracing in the event of a pandemic. So, let me just pick one obvious example. Almost every single one of us, knows that we have smartphones that now have the ability to alert us if we've been in close proximity to an individual who has tested positive for COVID-19. Apple and Google together have developed and implemented this feature and then deployed it in collaboration with public health departments across the nation. I think technologies like this one, along with modern data mining and dozens of other techniques that frankly just didn't exist 20 years ago, come with their share of challenging questions that range from policy to technology to medical practicality. And they're tough questions. Questions like, what does it mean when, in the event of an emergency, a government can use its powers to track down almost every single one of its constituents? How do we build more systems like Apple and Google's that enable detailed and powerful results while also protecting our privacy rights? And if we possess the information, how do we use it to safeguard public health while still protecting individual privacy? I think that and much more is what we're here to talk about today. As Mike referenced, we've pulled together really two exceptional panels for all of you with experts in medicine, epidemiology, public policy, law, and technology. And, you know, I think what I would say is that we're sort of looking at this both where are we today and where are we headed? So the first panel focuses on today, what tools and techniques are available to us, and how we use those tools and techniques to track the spread of a disease across the population. The second panel is more about tomorrow with new technologies, many of which have been developed during this COVID-19 crisis. How will we respond to future pandemics? But both panels will focus on the inherent privacy challenges and tensions that come with expanded contact tracing and address the issue of how we balance the importance of tracing with protecting privacy and preserving the public's trust. Now, our goal is to be sort of interdisciplinary about all this, as you might imagine from the range of expertise we've brought to bear. I think 21st century public health really does require expertise from these different domains, and it would be impossible to understand the whole without hearing from them all. While we have the conversation today, understanding that there are no easy or obvious answers to these questions, I think a little bit of humility compels us to realize that we don't know what the future will hold. We don't know what future pandemics might look like or when they might come. In some sense, it's hard to feel that way right now, but we're fortunate that it's been over a century since the last pandemic of this scale impacted our country. But other parts of the world have not been as lucky as we know, and whether we're talking about an outbreak, something that's endemic, epidemic, pandemic, you know, we just have to accept the fact, I think, that we know that moment will come. And while, as I say, admittedly, we can't know exactly what will come or when, we can try to prepare as best we possibly can based on what we learned today, and to try and make the next event less disastrous for all of us. Tackling the challenge of contact tracing head on is, in my view, a vital and important component of any pandemic response. And if we think about these problems today with clear heads, creativity, and good intentions, we'll be able to save lives tomorrow when the next difficult event is upon us. So let's get started because really we don't have a moment to share. Let me say thank you very much for being with us once again. And I look forward to learning a lot from today's two panels. Mike, back to you.
Jordan, thank you so much for your remarks, Supervisor Simitian. This segues very well into our first panel discussion on contact tracing fundamentals and new technology. And considering the wide range of backgrounds and experience of our audience, from beginners to experts, we wanted to offer everyone a general overview of contact tracing just to lay the groundwork, provide some key points to know about, and the new technology solutions on the horizon. With that in mind, I would like to offer introductions for our first panel, and then our moderator will get us started. I'll keep this very brief in the interest of time, and for everyone who would like to learn more about our panelists' backgrounds and expertise, please feel free to refer to our event program, and that'll give you some more details. So for this discussion, Professor Brian Ray with the Cleveland Marshall School of Law will be our moderator. Professor Ray has extensive experience in information governance, cybersecurity, and data privacy. He co-founded and directs the Center for Cybersecurity and Privacy Protection, and his research focuses on security and privacy regulation, national and international jurisdiction over data, and data governance, among several other areas. Also with us today is one of our very own colleagues, Dr. Sarah Rudman, who serves as the Assistant Health Officer for the County of Santa Clara Public Health Department and STD HIV Controller. Dr. Rudman has held various roles in the COVID-19 response for the county, including several as Director of COVID-19 Case Investigation and Contact Tracing. He has also worked in the Infectious Disease Branch at the California Department of Public Health. Assistant Professor Michael Reed is an infectious disease physician at San Francisco General Hospital and the University of California, San Francisco. He's the Associate Director of the Center for Global Health Diplomacy, Delivery and Economics at UCSF. Since the start of the COVID-19 outbreak, he has been seconded to San Francisco's Department of Public Health, where he is involved with running the contact tracing program. Dr. Reed is also Chief Medical Officer for California's Contact Tracing Academy and heads up UCSF's Pandemic Initiative for Equity and Action. Aaron Deacon is the founder and managing director of Kansas City Digital Dive, a nonprofit civic organization with a mission to make Kansas City a digital leader. He works with mayors, entrepreneurs, and civic leaders in Kansas City and around the world to help build ecosystems that connect infrastructure, emerging technologies, and social impact, including in the area of contact tracing technology. He combines a high-level strategic approach with boots-on-the-ground project implementation and management in smart cities, civic tech, digital inclusion, digital health, and education. And from the Massachusetts Institute of Technology, we have Hira Dangal, a fellow at the MIT Media Lab, who comes from strong industry experience in technology and product engineering, architecture, executive roles in leading technology companies, service providers, and Silicon Valley organizations. Mr. Dangal is also an advisor to PathCheck Foundation, founded at MIT, a nonprofit dedicated to providing robust digital solutions to contain COVID-19 and revitalize economies while preserving privacy. I think we're in for a very engaging discussion, and right now I'll go ahead and hand it over to Professor Ray to get us started.
Thanks so much, Mike. And thank you for putting together this really great set of folks for the first panel and the second panel. Our job, as I understand it, is to set the table for this discussion. And so we're going to first talk about manual contact tracing, which is a process I know I had never heard of until the pandemic started. I'm sure that many of our audience members had not either. And then we're going to go into and really lay the groundwork for the next panel in describing some of the new technologies that are emerging, and then we'll hand it off to them. And so to get us started, I'm going to turn to Dr. Rudman and ask her to just briefly sketch out what is contact tracing and why is it so important.
Sure. Well, thank you so much for the chance to be here. Thank you, Mike, and thank you, Supervisor, for this opportunity to have, I think, what is an incredibly important conversation. And even as the three-legged stool you described as adding the fourth leg of vaccination, which is going to be what makes this such a stronger and very different response and make this year look very different from last, this contact tracing work is going to continue to be really vital. So I will take my mask off because I am in a private office here with the Public Health Department Operations Center. And just give you that overview on what is contact tracing, where it comes from, and why we're so focused on it. So it is an old tool. It is something that dates back from the beginning of public health. The idea being for any contagious disease, if we can start with somebody who's sick and ideally look both backwards and forwards, we can both understand why the sickness is spreading and stop it from spreading. So again, in a perfect world, we're looking backwards to understand where the illness is coming from. Where could this sick person have gotten exposed? And for that, we need to understand how long it takes somebody to get sick after exposure and how the disease spreads. And sometimes we might find a specific source that's still ongoing. We find that often in foodborne outbreak exposures, or for those of you who know the story of Typhoid Mary, who was walking around feeling well, but carrying typhoid that was making people sick. Sometimes we find a sick person who's still out there spreading disease when we look backwards. But the more pressing issue is looking forward, saying, while we're looking at this person who's sick right now, they are contagious. And what we understand about how the disease spreads and during what time frame can tell us who they might have exposed. And so this manual contact tracing involves us asking that person, tell us everywhere you went, tell us every person you came in contact with. And based on how the disease is spread, we'll reach out to every single one of those folks and do what we need to protect their health. If it's soon enough that we can keep them from getting sick, in other diseases, sometimes vaccination after exposures or medication after exposure can keep somebody from getting sick. We'll do those interventions. Or if all we can do is keep them from spreading to somebody else, we will do just that. Keep them home, keep them in quarantine and protected and safe during that time so that the chain of transmission stops there. And this really works well and was historically built when diseases moved slowly. I'd say there are two key features that set us up for success with contact tracing. The slower the disease moves, the more able we are to move faster than it does, to get to the next sick person before they're contagious, or get to the next exposed person before they're sick. And then the other thing is, the more people know who they exposed, the more effective this is going to be. So my background is in sexual healthcare, and you can imagine people are much more likely to know who they had sex with than to know who they stood 6 feet away from. Or when it comes to foodborne diseases, people don't always remember everything they ate 2 weeks ago, but they may be more likely to know that than know the name of the person in the grocery store aisle next to them. So the more people know about who they exposed, which has to do with how the disease is spread, and the slower it spreads, the more effective this type of manual contact tracing is. And it's something we've seen work in everything from measles to HIV. And so we've tried to take what we've learned from that 100 years of doing it in other diseases and bring it to COVID. And I'd say there are ways in which it's worked really well and ways in which it hasn't.
And just to follow up briefly on that, since it is Data Privacy Day, could you elaborate a little bit more, especially in the context of COVID-19? What are you asking people who you're doing this process with, and how do you gain their trust?
That's a great question. So there's some information that comes to us at the Public Health Department and some that we have to go out and find ourselves. California Health and Safety Code requires every laboratory and every doctor or nurse to tell us when they've diagnosed somebody with a disease of such importance as COVID. So some of the information comes to us in protected electronic form when a laboratory tests somebody positive. So if I went in and got my nose swabbed for COVID, in order to do that, I'd have to give them my name and date of birth and address and phone number, and ideally some demographic information, my sex and gender and race and ethnicity. And so that information is automatically transmitted to a state database that the Public Health Department has, and that's where the investigation starts. We've got that report of the person who is sick now. Then we have to call them and have exactly what you said, this complex and tricky conversation to both demonstrate that it really is the Public Health Department calling, and to help them understand that the goal of us asking them to jeopardize their own privacy and share additional information is going to benefit them and their family and their community out of proportion to the risk they take in doing so. So I would say that part of what has been so difficult is everyone's different in their willingness to engage in that conversation. Some people are like, oh, of course, here's everyone I know and their phone number and address. Others say, why should I trust you? And what are you going to do with my information? How will it be protected? So that information, that conversation is a little bit different every time somebody has it. But specific things we do to create that trust are use a standard phone number. So whenever we call somebody, it comes from, unfortunately, it's a 916 number, not a 418 number, because it's built out of a Sacramento statewide system. So if someone's getting a call from us, it will say California COVID team. We send a text message just before we call to say you're about to get a call from the Public Health Department. It's the real deal, please pick up. We have some information that we can use to verify with those clients that we're legitimate and that we have basic information about them already, so it doesn't seem like we're phishing. And we are calling equipped with important health information, resources, and the guidance that they will need to help keep their family and community safe, that we hope makes that exchange for their private information seem worthwhile to them.
Excellent. And I'm going to circle back to some of those issues and tie them together with the differences in the digital tools that we're talking about. But before we do that, let's keep going. And by the way, to the audience members, please feel free to start putting questions into the Q&A as they come up. We'll collect them mostly to the end, but if there's something that needs clarification during, I'll try to pull it in. So Dr. Reed, you've been extensively involved in the contact tracing effort and the COVID response generally. Could you tell us a little bit more about how it's been working in San Francisco? and what's worked well and what hasn't?
Yeah, well, again, thanks for having me, Supervisor Smidgen, and the rest of the panel. It's a real pleasure to be with you, really grateful for the opportunity to share the insights from San Francisco. What I can tell you in terms of how the contact tracing effort has worked well in San Francisco is first of all, actually, a lot of people answer the phone. About 70% of people are answering the phone first time around, which is a real success, I think, and speaks to like a concerted communications effort across the county to reach those populations most impacted by COVID and understand the need and the importance and the shared responsibility of answering those calls that Sarah alluded to, the 916 number. I think another success that wasn't initially a success has been how we've been able to respond to the epidemic in specific underserved populations. And so in San Francisco, there are certain zip codes with a much higher proportion of people that identify as Latinx or Hispanic, where we have seen far higher incidence of COVID. And by virtue of mobilizing a contact tracing workforce that speaks Spanish is from the Latinx community, we are increasingly successful at reaching that population. So right now, our contact tracing metrics show that we're reaching about 80% of people who identify as Latinx or Hispanic in those zip codes, and I think we're proud of that. Another sort of metric for success is how quickly we're reaching people. And again, Dr. Rudman alluded to the fact that time is of the essence. In order to have an impact, we have to reach contacts as quickly as possible so that they can safely quarantine and do so before they're infectious and spread the virus to those around them. And at the beginning of the epidemic, it was often like 5 days before we were able to get somebody on the phone and say, hey, you need to quarantine. Right now, most of the time, particularly in those priority zip codes, we're reaching people within 24 hours. So I think that's evidence of improvement. And then the final area where, again, I think we're seeing the dividend of investment across sort of the full continuum of services is getting close contacts tested as quickly as possible. And right now we're seeing approximately 50 to 60% of all of our close contacts getting tested during that quarantine period. I think that's evidence of how the endeavor is working. You also asked where are there opportunities for improvement. This disease has exposed the fissures of inequity within society more generally, and they still exist. And I think we still have a ways to go to reaching specific underserved populations in San Francisco. I think the recent surge has also sort of expose the fact that we have limited resources, and how can we use those resources more efficiently? How can contact tracing happen within the confines or the constraints that we face, and still work as effectively as possible? And are there digital tools and the like that can afford us efficiencies? And then one sort of concrete thing is that when we call people, of the people that answer the phone, when we ask them if they're a case, when we ask them, do you know who you were exposed to? About 30% of people don't know who the case was that they were exposed to, and how can we do a better job of identifying their exposure and therefore understand the disease better, but then also be able to control it? And again, that's something that Dr. Rudman alluded to. So there's some opportunities and some examples of success, Brian.
Yeah, so thank you for that. And I've got a couple of follow-up, but we did have a question from the audience that I wanted to get in here now. Which COVID positive individuals does the public health department contact directly?
We do attempt to contact every single case we know about. So the limitations there are sometimes those will come to us without a phone number and we cannot find one no matter how hard we try. But with this latest case surge, it has been harder to try everyone immediately. So we have prioritized those who are more vulnerable, either because of their living condition or their age or anything we might know about their morbidities, such as their hospitalization status. But our attempt is to reach absolutely every case. And that's going to become even more, both more important and more feasible as our case rates continue to drop.
And as I understand it, to go back to what you said, Dr. Rudman, about sort of trying to get ahead and the interaction between the speed of the spread and the speed of the tracing process. The goal is obviously to get as many people identified and begin to identify their contacts to get them to quarantine so that they aren't spreading. But even if you can't get ahead of it, which has been the case, as I understand it, for most of the COVID epidemic, because it's moved so quickly. Nonetheless, even if you're doing it kind of retrospectively, there's a benefit obviously to those individuals, right? They can quarantine, they can protect the people close to them. So there's kind of two things going on at once. Is that right?
Absolutely. I think a big piece of those calls, both the call to the case to gain the information about who they may have exposed and the calls to the contacts to make sure they know they were exposed, aren't just a question and then a notification. It comes with specific resources that they become eligible for because they're a case or exposed, a letter for work so that they don't have to use certain types of sick leave to be outside of work, or a specific offer of hotel or rent support or other financial aid or food delivery, as well as fairly frequently we find that folks really are in need of healthcare and haven't yet been able to access that. And so often we're reaching folks who may not understand why they're feeling sick if they are, and may not have been able to connect to healthcare. So there are additional benefits for both the cases and the contacts, other than just sharing with us the information about the exposures and then receiving the notification that they've been exposed.
Excellent. And we have a couple other questions that relate to the app. So I'm going to pull those in when we get there. Just hold tight. Let's now start to talk about the technologies that are in play and that were emerging early on. And just to set the contrast, we've heard about manual contact tracing, a very thick process, right? Very personal, involves much more than simply identifying contacts, as Dr. Rudman especially emphasized, really creating this relationship and doing the work of public health. I'm going to turn now to Aaron and Hira, and both of you and I, to a much smaller degree, were involved in working on some of these new technologies. Can we, and Aaron, I'm going to pick on you since we've met before, and ask you to just take this question first and then ask Hira to jump in. Could you just briefly describe what are the sort of, what's the major digital contact tracing or exposure notification tools that are out there?
Yeah, I'll take a shot at that. So I will say first a couple things. One, and I think this was somewhat clear in what Dr. Rudman said. I think it's important to differentiate between the disease investigation piece and the contact tracing, because those are two different functions, and how you use, there's a role for technology potentially in both. And then beyond that, there's where we use technology to support those processes, and where there are attempts to have technology that is used to replace or fill in gaps where those processes, we don't have the resources to do them like we would want to. And I don't know, I won't talk too much about the technologies around disease investigation. I don't think that's where the apps are filling in so much. I think the model has always been, that you still got to have disease investigators that are doing that work. The really early promise and the kind of rush that you saw, in the EU, in Israel, and Australia, and out of MIT and a number of different universities and startups in the US, was to figure out, is there a way to use people's cell phones and the proximity of people's cell phones to each other, and the fact that there are sensors that are on everybody's body, to replace the contact tracing work, so that you actually knew, because, and then there were two main technology protocols. One was looking at GPS, so the location data that your phone was collecting and reporting. So kind of one main thought was, can we use that and see where people are clustered in the same location, and then infer, who has been in contact with whom. And the other one was to use Bluetooth protocols. So the pings that your phones have when they hit each other, so they kind of know where they are. And here, I know I haven't met you before, but I'm going to guess that you can talk to both those and may be able to provide more insight on the sort of pluses and minuses between those. Is this a fair place to hand off to you?
Yeah, definitely. Thanks, Aaron. So I truly appreciate for adding some insights out there. What I wanted to add additionally from some of the stops we did last year in early March, we first launched our exposure notification app through one of the research lab out of the MIT Media around mid-March. That's where I think we thought we were the first team to propose this decentralized privacy preserving scheme where healthy users never have to upload their information and server cannot centralize data about the residents. So we did our first writing on a paper about the unintended consequences of such apps. And I think the criticality around that is the design principles that even were referenced by the US CDC, and our team ended up with the first proposal of national coordination of the apps, even using this US congressional testimony. What we said around during that time was, we're here to collaborate, not to compete, right? So we have become one of the largest nonprofit open source project till today. And the way I think this has been the evolving process from, focusing on GPS enabled exposure notification to later on joined by our, Google Apple exposure notification API, focusing on the Bluetooth. And I truly see there is a value of more, not the one technology solution, but more from the combination of the available tools that we can use to give the better confidence from the user side. So that's where I see the two aspects, how we are collecting data and giving the value to the end user perspective and getting the same data going out to our public health official. So from the solution perspective, I think one specific use case, what I always thought from the digital contact tracing value added advantage is, some of the stops we use from the GPS enabled data, where that data can directly pull out by the public health officials, how this infected patient has been in last 2 to 3 weeks. So in the normal manual contact tracing, you have to literally do all the question answer today. So you can use the power of technology to going back to the historical logs and then tell you exactly where you've been to the different location throughout your last 2.5 weeks, right? So you can leverage those kind of the informational data that will optimize the some sort of the manual tracing and the interview process we have to run more efficiently. So I would say, I think the value could be more not like manual contact tracing has advantage over digital contact tracing. This is something we had been advocating. It could be more like a hybrid model as of today. Yeah.
Yeah, and so here, thanks for that. That's really helpful. Just to pull us back a little bit for those of us who aren't familiar, what was really interesting about the safe path check approaches, as you mentioned, initially it was a GPS-based protocol, and so it was going to collect direct location data, just like Google Maps does or Waze, and had a very creative privacy protocol that would store that information locally on each user's device and then require explicit consent if and when a person became infected and wanted to provide that information to manual contact tracers. And that would be directly useful in manual contact tracing because it would provide, as Dr. Rudman mentioned, unlike when you have sex or even when you eat, just walking around, you're not always aware of where you've been or remember it. And so it sort of interfaced directly with that. It also was planned to incorporate what became the Google Apple Bluetooth API, which the advantages of the Bluetooth, as Aaron mentioned, is it doesn't require the device to communicate with a cell tower or a satellite or anything else. devices just talk to one another. And unlike GPS, which can tell us generally where we were, the Bluetooth, using a creative algorithm and testing its strength, you can actually figure out, I think I was probably within 6 feet of someone, which is that epidemiologically significant contact. And so, as you said, you put those together and you've got a kind of really powerful tool, because now I can get this 6 foot proximity, and it works inside as well as outside. And also I can look at my record of GPS and say, oh yeah, you know, actually I was wearing a mask, or one of the problems with Bluetooth is it runs through walls. So, you know, actually I was on the other side of the wall, and it was, you know, I think, you know, I wasn't near anyone when that happened. But as I understand it, where we've ended up is Google and Apple decided, you know what, the GPS data is too sensitive. It's too potentially identifying, even if it's run through a public health authority. And so we're just going to have that Bluetooth proximity tool. And so as it stands now, as I understand it, the apps that are out there in the US are almost all or all using only that Google Apple tool, which just has the Bluetooth proximity. Is that correct?
Yeah, so I think the lot of the digital contact tracer of the apps you see out there has a capability to both, and or the Bluetooth only as well. The fundamental ask out there is how those data are being used somewhere else, right? That's the one fundamental question that we have seen from the day one when we got our idea has been productized, and one of the challenge was how are we building the confidence to the user-centric or human-centric design aspect where we can preserve the privacy aspect of the, you know, you call it as a PII data or some of the basic information, right? So some of the solution we thought of as a separate tool that we can dedicate to the public health official, where they can still redact the data. So that becomes like, you know, anonymized data that can be beneficial to from the public apps user perspective, whether we are using GPS specific data or Bluetooth or any kind of the tools or technology that is available today on the you know, these mobile solutions, right? So that's where I see more value is coming as a, you know, combination of both technology, not specific to one aspect of what we call as a Google Apple exposure notification. This could be one API that can be leveraged to, you know, one general public audience specific apps, or there could be demand for like business or, you know, schools where we need to reopen them, and they're all beneficial of using the combination of those technology and capability, I would say.
Okay, and so we had a couple of questions about the California app, and that might give us a nice concrete way to get a little deeper into this. And Aaron, I don't know if you're familiar with California Notify, but I'll describe it briefly. It is a Google Apple system app, and so it is limited to the Bluetooth proximity function. It's, you know, it's the same model that most other states now have adopted. And so Aaron, could you just describe a little bit more about how that Bluetooth model is privacy protective, and maybe what its limitations are?
Yeah, I mean, the idea behind Bluetooth, so, you know, every phone has a MAC address. It's a you know, long string of numbers and digits that are kind of the unique identifier for the phone. Your phone is recording the MAC address of the other phones around you through Bluetooth, in the same way that, you know, Wi-Fi hotspots that you walk around, they find your phone, they discover your phone when it walks by. So this is kind of a background language that devices use to identify where each other are. And the idea behind this protocol is that Apple and Google, which, you know, have this embedded into their phones, into the operating system of their phones, which already has a certain layer of security around it, you know, can keep a track. They can keep track of the MAC addresses that you run into, and then there's a variety of ways that you can build out an app to share that. My understanding was that Google and Apple were building the protocol, sort of the backbone layer of how things talk to each other, and leaving it to, you know, developers to develop the actual implementations of that. So each state The idea was that each state, or they would allow one app within each state to use that, and so you've still got some availability within the states to to choose what you use. I think it was really interesting to me because when we first started looking at this, that actually seemed in some ways as invasive or more than the GPS. So everybody was, really scared of the GPS. The idea that somehow a list of people that you've been in contact with for how long is less sensitive data than the physical place that you've been, I think is really interesting. And I don't know that it was really fairly vetted. I don't have a super strong opinion on that, but I do think one of the things that you said, I don't know if you said it this way on purpose, was that Google and Apple decided the GPS was too sensitive. And so that says something about our decision-making capacity in terms of how we evaluate these options that I think is really kind of one of the takeaways is we all know that the big tech companies make a lot of decisions about what protocols we use and what the trade-offs are. And I think there's an argument. I know Steve, Penrod, who's on the next call, was part of the technology team behind, or the next panel, at the early stage of the path check work. And, we had a number of conversations about that and with some other app developers, about what the relative merits of those are. And, again, I don't think we resolved that, but I also don't think it's so clear that that the Bluetooth solution is better. And I think some of the elements, in that conversation are really not the technology elements. It is where does the data go? It is who has access to it? Is what do you do with it? How centralized and how decentralized is it? How do you share it? How do you authorize sharing of it? How do you give permissions to share it? Those are all some of the things that, are really implementation factors that I think need to be considered when you're trying to evaluate the privacy and public good trade-off, which is really what you're ultimately trying to do, because there's a balance between those two things in any of these solutions.
Yeah, and so just briefly, I mean, it's really interesting. I want to probe back on the Bluetooth, the sensitivity of Bluetooth data, because at least from my perspective, I mean, that is the most privacy protective way you can try to do something here, right? You've got anonymized rotating Bluetooth identifiers that's stored only on the phone. And without time or location layered onto it, the only thing is there was a potentially significant exposure, right? And even that's subject to the vagaries of the Bluetooth strength and how well the algorithm is tuned. But from a privacy perspective, there's not much else you can do with that other than say, hey, you might have been exposed, right? And if you live a very limited life, you might be able to reverse engineer a bit. But let me pull in Dr. Reed and Rudman, because we had some questions about, all right, well, what does this do for public health, right? So let's take the Bluetooth only model and we'll circle back to what Hira had talked about if we layer GPS on. How is it helpful from your perspective? And either Dr. Reed or Rudman, please take this.
Yeah, so Sarah, I'll quickly start and then you can jump in. I mean, I think, clearly any resource that can support our overstretched public health capacities is an asset, and this technology could really help us, if it can improve efficiencies. From a sort of a nuts and bolts point of view, if somebody tests positive, that their result is logged with CDPH, then if they have the app enabled on their phone, then they'll receive a text message, and in that text message there'll be a code. They enter that code into the CA Notify app or software on their phone, and that will trigger an alert to go out to all of those people that have CA Notify also enabled on their phone that they've been exposed to during the period of exposure. And so if you're exposed to that person, you receive an alert on your phone saying, hey, you may have been exposed to, you may have been near somebody who had COVID-19. Let me direct you to a website where you can find information about quarantine and testing. That's essentially what the app does. It puts all of the onus on the individual to act on the information, and so you can ignore it, or you could do something about it. And who knows whether lots of people are ignoring it. You know, the ways that we can evaluate this app are adoption of the app. How many people in California have adopted? I think we know that there are something like 8.6 million people who have downloaded or enabled the app across the state. Interestingly, 90% iOS users, 10% Android, which I think raises some equity issues itself. And then the only other two metrics for evaluating are notifications. So do people, do they receive a notification and act on it? And then that code redemption, do people use their codes? Those are very hard to evaluate in terms of their impact on the epidemiology of COVID. And I think for me, that's the major concern. We really are esteeming privacy with this infrastructure, but we have absolutely no way of knowing whether it's having an impact. It could be like digital Plaquenil, right? Without a randomized controlled trial, we have no idea whether this is really helping. My hope is that it is, but who knows? Over to you, Sarah.
Thank you. Yeah, I like your digital Plaquenil, and for anyone who wants to nerd out later, we can explain what that reference means.
Yes.
But I think so it solves this Bluetooth-based notification system, and specifically the one we've adopted in California, solves in part two of those problems I started out framing, that COVID moves faster than manual contact tracing can usually keep up with. And no matter how fast we are, no one's ever going to share the name of a contact they don't know. If I stopped and spoke to a stranger for 15 minutes and I have no idea who they are or how to reach them, the manual system working perfectly will never overcome that. And this system theoretically could. But the problems with how well it solves those two issues that manual contact tracing struggles with are just as Dr. Reed was laying out, that it is entirely based on opting in prior to getting sick, prior to getting exposed. It requires you to have a cell phone. It requires you to be willing to share this information, or to just, remember to follow that instruction to turn it on. The onus is on the individual to then activate it if they test positive. The onus is on the individual who receives the notification they've been exposed to do anything with that notification. And so all it does is solve the reach that individual and do it faster and cover some populations that we otherwise couldn't reach. Now, I think that's incredibly valuable. And I, again, defer to the experts like Aaron on how privacy protecting it is, but I can tell you, my perception that it is highly, highly privacy protecting does come from what Mike was describing as the downside of it, is that it gives almost no information to public health. So we have no idea, aside from what he shared, how well it's being used, how effective it is it reaching the right populations? Do the people who get notified actually end up getting sick? And then the last piece is all of those other things that the contact tracing calls do. So gathering additional information from cases or offering specific resources. Early on, it was very hard to know where to go get tested if you were notified. And we really held people's hands through understanding where they could go and how we would help them do that. And I think the equivalent now is going to be, if you've been exposed, we know you're at ongoing risk. We'd love to get you vaccinated as soon as you're eligible. And so the manual contact tracing work is building in that vaccine scheduling piece. So this is one more piece where the resources that come with the contact tracing call may not be able to come with that automated notification. So that's one more reason I think these systems will continue to have to work together, but one reason why we're at least hopeful that this California Notify system has overcome some of those inherent deficits to the manual process.
And so let me follow up on 2 points, and either Dr. Reed or Dr. Roman or Aaron or Hira jump in. We had a question about equity, right? And obviously, as you mentioned, you got to have a smartphone. You actually have to have the most recent operating system, so you can't have an old smartphone for this particular system to work. As I understand it, that dovetails with what you said, which is, well, this is actually sitting parallel to the manual contact tracing system. The public health authority gets involved by issuing the certification of diagnosis, but everything else, as Dr. Reed said, is up to the person, unless and until they call the public health up and say, hey, what's going on? I need more guidance, right? But at least in theory, then that might enable a probably wealthier, more resource population to kind of take care of things themselves and allow public health authorities to prioritize in the way that they've had to anyways. Is that Is that correct in terms of the at least
I think that's yeah, I think that's a great sort of summary. You know, this could enable you to prioritize resources to those underserved communities who are most likely to be digitally disenfranchised and least likely to have a smartphone, and focus the manual contact tracing to those populations. Absolutely, that might be a useful lens for thinking about how this could support public health work.
Mm-hmm. But as I understand right now, in part just because there hasn't been significant enough adoption, at least right now, you're not actively sort of putting that into your global calculus of prioritization, or you tell me.
Yeah, it's tricky. We are and we aren't. Even before California COVID Notify went live, we were doing our best to prioritize disenfranchised populations because they were the hardest hit populations anyway. So to some extent, we have started from point A and are moving as fast as we can to cover everyone. And if California COVID Notify happens to be starting with point Z and moving towards us, then that's a well-matched system. But we don't know where to stop. We don't know who's been notified. We don't know who's adopted it. We don't know whether that's working successfully. So it will be very hard in terms of things like resource planning or saying we never have to keep going all the way to Z, because we actually don't know whether those folks are able to make full use of it. I'm hoping that's something we'll be able to learn and understand better through some of these other data mechanisms. But at this point, in terms of understanding, could we scale back some of how we do contact tracing differently because of California Notify than we already are based on resources and who's getting sick and who needs assistance in being able to isolate and quarantine? I haven't yet seen our ability to change based on it.
And one more just real detailed follow-up, because I'm curious. Do you get that list of notifications that come? No, you don't know whether it's an app-based or just, because all you know is someone goes and tests, right? There's no visibility, and that's by design, right? The whole one of the benefits again is contact tracing is intrusive and personal. If I don't trust the public health authority, even at least this might notify me, right? And I might be able to get notified even if I'm just mistrustful of any government action. And of course, it's up to you both to go get tested once you've got the notification, and then decide if you're going to put into the app the fact that you tested positive, which is what triggers other people in this system to figure out that, and again, anonymously, it won't be connected to you. Hey, that my phone collected your identifier. I don't know who you are. I just know somebody, and so I should go get tested, right? That is sort of this self-perpetuating system that, if again, mass adopted, you might get some significant benefit. Now, let me turn back to Aaron and Hira, and just I think we've got about 2 or 3 minutes before we want to open it up to questions, and I'll go back to the list. What is the advantage of, as you describe it, Hira, the original Safe Paths model that would layer GPS data together with the Bluetooth proximity? Like, why do you need both? Why not just the one if Bluetooth is more private? Because of course, location data could be identified relatively easily if you collect it.
So I can take a shot at that. I mean, it just depends on the application. So I think and it's interesting to see how the language around it has evolved. I think talking about it as an exposure notification act is really significant, because that's what it is, that's what it's doing, and that is really a supplement to contact tracing. It is not a contact tracing app. It is not doing contact tracing. So if you want to provide information to your contact tracer to help them, so part of the thought on the GPS side was, you're doing this anyway. A contact tracer is going to call you. Someone from public health is going to say, hey, where have you been over the past 7 or 10 days or whatever it is? You're going to say, I have no idea. And if you have a record that you can pull up and share that, then that provides some aid to that process. It's probably not, if you use GPS and location data, going to be as effective for exposure notification, because somebody's phone may know that you were both at the same grocery store within the same 20 minutes, but you may not have been anywhere near each other. So for that sort of data, the Bluetooth protocol is going to be more effective. I think, you know, either of them can be private if they're stored in your phone and you have complete control. I think where you get into questions is, you know, what are you sharing with your health department? And the fact is, in contact tracing, you do share sensitive data with your health department. That's the whole thing that makes it effective. So you can't get rid of that and do contact tracing. Now, you can do other things. And, you know, I do think, you know, as the way that Bluetooth works to do exposure notification is really valuable. And I don't think there's any reason to think that, you know, isn't privacy secure doing what it does. But it's just kind of being clear about what function each piece of the tech is doing and how you manage your data sharing to achieve that function and maintain privacy appropriately.
Yeah, so to add one more, I think the capability around the contact tracing technology and existing solution we have been produced as of today, things around the GPS and Bluetooth, right? There are additional capability within the mobile phone system, which we have not explored yet. So these are the things I think from the standardization of the solution offering end to end, whether you are focusing on the, you know, customer, which is a user-centric solutions like the apps, or public health official using their one legacy system, how these are interoperable across the whole ecosystem. I think that's one of the challenge, what I have experienced from the day one we involved on this kind of the work. And the mass adoption has been one of the biggest challenge, despite of we have, like, you know, numerous apps that was you know, built and released out there almost every part of the jurisdiction, but we still have the limitation around that. So that's where I think the one fundamental question of what we need to address is how this capability is being utilized in building the confidence level to the user, at the same time preserving the privacy information, right? So that's what I see. You know, there is a similarity between GPS, Bluetooth. There are fundamental overlapping aspects we may see on both the solution, but the question is how we're consolidating this kind of the solution, making this in-house within the ecosystem, and this does work as seamless as possible. So this can be value add both from the, you know, user-centric aspect to the, you know, provider side, and that's what I think the most focus needs to happen. Maybe for this pandemic situation or the next big pandemics that's going to happen, God, we don't know what that could be. But do we have the preparedness in place as of today, or is there a plan that we're working on as a disaster preparedness initiative, which is going to be tested and validated more often, time and again, right? Regardless the things that happen, and we do have some kind of working solution that we can deploy as it needs in the future, or sometime, you know, as we see those kind of the massive you know, pandemics or some other kind of the natural disaster happen around us.
And so I want to follow up. We have a little more time than I thought. We're going till 1:50, and so I will, audience members, get to a lot of the questions. I'm going to try to pull some in as part of this as well. But to follow up on a thread that Aaron raised, and I think that intersects with some of what Hira is saying. So manual contact tracing, you're getting location data, right? You're getting lots of detailed information. And you've got a set of protocols and a process and conventions for protecting that, right? And reassuring the people you're talking to that, hey, your data is safe with us. Could you just elaborate a little bit on how that works? And you know, just in the run-of-the-mind public health system, you're every day collecting lots and lots of sensitive data, right?
Yes, and you can imagine I certainly rely on much more expert legal minds and technical minds to assure me that both the databases themselves are locked down and highly secure, and from a technological aspect, and that we are collecting the bare minimum of allowable data and sharing it only in the minimum of circumstances where we need to share it. So for example, we do everything we can when we notify someone as an exposure to keep to whom they were exposed confidential, anonymous. That said, similar to a Bluetooth notification, if you know you only saw one person on Tuesday and we say you had an exposure on Tuesday and we need to tell you it was Tuesday so that we can calculate how long you're in quarantine, you're going to figure out who it is. But we're not going to share that information unless absolutely required to move forward with some sort of highly sensitive notification. Really what I end up involved in is the potential that I think comes across every privacy consideration of human error, that I lead this very large team. And when we talk about the size of the public health resource needed to do the manual contact tracing, we've had on the order of 1,000 people for Santa Clara County be able to support this manual contact tracing. And so it's ensuring that all of those folks have received the same privacy training, that every time they need to reach out for help with a tricky case or somebody who needs extra support, that they're doing it via secure means, that they are only entering information into these highly locked down databases and nowhere else, and that every piece of the process, which we've also again had to do entirely remotely since the beginning, every piece of information, every case assigned to them to work on, or every time they have to pass it off to another team member, also that transfer of information is happening securely. And so we've had assistance primarily at the state level to build a statewide database built in Salesforce that allows us both every element of that, the assignment of the work, the collection of the information, the questions we're going to ask are right there, so that we don't need to pull in external systems to pass private information from one team to another. And so my job a lot of the time has been to make those systems functional from an operational standpoint, but then make sure that the human beings using them are using them correctly so that the full power of those privacy protections are working for us.
Yeah, and so I think part of what Aaron was suggesting, and Aaron, correct me if I'm wrong, is if we layer GPS, more identifiable, more personal riskier information into a contact tracing app to help us cross-check against the Bluetooth to see if in fact, I was in a place and not separated by a wall, or, or just to augment manual contact tracing directly, those same systems, at least in theory, could protect it if you're uploading it in the way that the SafePaths app did it. And the concern, however, is, yeah, but it's much different if Dr. Rudman and her team, even if there are thousands of people, are going out and calling people one by one, versus if a whole bunch of people have downloaded an app and they're constantly collecting and storing this data. All of a sudden, you've got at least the potential for this really enormous, rich database. And either Aaron or here, the concern, as I understand, that's just going to be too tempting, right? If law enforcement, if there's something else that data might be useful for, it's just going to be too tempting, and we risk just by collecting it that it might we might allow a centralized authority to get access to it and use it for something other than public health.
Yeah, so one thing what I wanted to clarify in terms of the use of the data and how this is being populated as we go into app-based, right? So things we have seen on the path check side is data never leaves the apps. This always stay within the user application. It only goes to the voluntarily into the another location, which is public health official. It's another public place is what we say. I think that data is being redacted. That means, it becomes anonymized, right? So that means this is not in use by anyone else. So this will be the only data that was redacted. This will be populated to across the, the available user. So this becomes the helpful notification to someone who may have been in contact with the, those locations, right? So in that aspect, I think, how you are using data is more critical than where data is being stored. And that's where I think the privacy preserving solution is critical in that aspect. I think if you are relying on GPS, we really need to think from that angle, how your data is being used and where and are we using those as a kind of like, anonymized data, or this is more stored today as how server does, right? As a IP information, your public information. That's the number one challenge a lot of users tend to see in terms of those using the GPS specific solution versus the Bluetooth.
Okay, and just to elaborate on that, so PathCheck's original proposal, which would have used GPS, was essentially relying on the public health authority system. It was going to run exclusively through the public health authority, and they were going to have a tool and a set of protocols to, first of all, scrub it and ask each individual, are there any sensitive locations that you just don't want uploaded? We'll get rid of those. And then before it got stored, it would be de-identified and only used in an aggregated form. Is that correct, Hira?
Yeah, that's the redacted data, I would say, right? When
yeah.
it's a separate solution. So it has a public centric apps, which is we use in the mobile app, but there is a safe places. What I've seen is a separate solution that is dedicated to the public health official. It's never used somewhere else. And that's where the most of the redaction does happen. So that means the user data which is voluntarily shared to in the benefit of some massive deployment or the other notification that goes. So it will never be rebuilt as a public facing data. So that's what I see with the more value out there.
Okay, and now I am going to pull in just go through questions sort of one by one. But just to clarify, since we covered a lot of ground, the current CA Notify app is a Bluetooth only app, does not collect any GPS data, and that Bluetooth information really is very difficult to re-identify in any way. And so that brings me to the first question, which is, should I download the CA Notify app? Will it help? And I'm going to add, which I worry.
Maybe I can just respond to that with some modeling analysis that I think seems to suggest that it would help. A study from Oxford University done looking at uptake of an app in Washington State showed that if you got 15% of the population to adopt, then you could see a reduction in 15% of infections and 11% of deaths. And if you could get 60% of the population to adopt that could lead to 50% reduction in infections and 55% reduction in deaths. Even if that's only, roughly approximates what could actually happen, those are just such huge dividends that this feels like it would be worth doing. And so I think that provides persuasive modeling analysis to support uptake. So yes, you should download the app.
And I think, if I remember correctly, that study, actually, that's 60% of smartphone users. Those percentages are on smartphone users. So it's even better than, because obviously you're not going to get a percentage of people who don't have the capability. So yeah, that's those studies, seem to suggest if we can get enough uptake, it'll work. Aaron, do we need to worry about our privacy if we're collecting the way it's structured in the CA Notify, which follows the Google Apple Bluetooth only structure?
No, I don't think. I mean, not any more than ever. Right? I'm always worried about my privacy. I mean, we've got these sensors in our phone that we carry around with us all the time that have a tremendous amount of information. But I don't think, and I think there's absolutely a way to use and to exchange Bluetooth information that keeps it as private as the other info you have. And if they're not sharing stuff into a central database, as far as I know, that's not a reason to not download the app.
Yeah, and what's remarkable about it is certainly Google. I mean, Apple was better on this before, but I mean, the restrictions on the app go well beyond any restrictions on any of the run-of-the-mine consumer apps that they've got on it. You can't sell the data. Only the public health authority has to sanction the app. And again, no one really sees it except the user. It's stored on the phone. I mean, it does get sent up to the centralized server to match, but beyond that, it's a kind of self-contained system. And even if you got access to it, there's not much you can do with it. And here I want to highlight that the news a couple weeks ago about the Trace Together app. Sorry, the Trace Together system in Singapore. There was news that they were using it, allowing law enforcement to use it, and that confounded me a little bit because I thought, well, hold on. What can law enforcement do with these Bluetooth identifiers? Well, it turns out when they talk about Trace Together, they're talking about the whole system, the QR codes, and lots of other things that are identifying versus the CA Notify app doesn't, right? And so that brings us to another question. Do public health authorities use other sources of data to contact trace, like grocery or supermarket buyers cards? or credit card data. And this is the kind of stuff South Korea was doing. Is California using that kind of information to try to independently identify contacts?
So we have the authority and ability to. On the scale we're talking with COVID, I would say it would be incredibly, incredibly rare for us to decide that the benefit to an individual's safety outweighs the violation of privacy in those settings. But I have seen, foodborne outbreaks where people are dying from certain food sales, and we have gone into Safeway's system and figured out every person who checked out at Safeway on a given day, just because we know that they are at risk of getting sick. So there are options to do that kinds of information, or if we, are desperately seeking a very sick client and can't locate them, there are ways to try to look up phone numbers. Yes, those types of tools are used, but it is up to local authority to decide how to use those and really ensure that we're doing so judiciously. But again, I think it does sort of emphasize Aaron's point that the baseline of privacy that we all think we have and truly have is probably no worse at all by opting into this app. And so to the participants' question of, is there a benefit? It does seem like, yes, absolutely, the benefit of opting in far outweighs that tiny add to privacy risk that may come from it.
And can I ask, Hira, just mechanically, I don't remember this or know if this has been preserved. Is it a list of MAC addresses that is the file that is stored on your phone?
For the Bluetooth one?
Yes.
Yeah, that should be related to the MAC address and the local file. We call that as some sort of a config file.
And so to your question, Brian, about what could someone do with it? I mean, I think in some instances people act like a MAC address is a super secure thing, or like a super anonymous thing, like, oh, it's just my MAC address, nobody knows what it is. And there are some protocols out there that rotate your MAC address that not everyone uses, but so your MAC address may not be your phone, but there are a lot of phones out there still that just have one MAC address. And to think that there aren't people someplace, either on the good team or the bad team, who have big lists of MAC addresses that can use those and go back and find out who people are, I think is short-sighted. So, anytime that you've got a unique identifier that is being collected someplace, even if it's staying on your phone, there are ways to trace that back.
Yeah, and also the cryptographic keys, what we've been talking, right? That's one additional how the share keys are used to at least identify those kind of the Bluetooth locations, and the data is being shared across the to user getting in the proximity of those environment, right?
Yeah, as I understand it, it's a rotating set of keys, not a static MAC address that's being broadcast, and then those are the things that are collected. And so while there are some attacks, if you've got a Bluetooth camera and you're willing to stand at an intersection and then reverse engineer the notifications that go up against the rotating keys you've collected, which is, possible, but, much harder than say, oh, I just need to figure out that I got this MAC address, right? But I could be wrong about that, but I think that's how it works. Real quickly then, just a detail on the limitations of Bluetooth. Someone asks, we say notify if you're in a townhouse or apartment building, so dense living conditions, could you get a false notification from a neighbor on the other side of the wall?
My understanding, the guys with tech expertise could speak to this better, but there are algorithms that sort of account for attenuation, between walls and stuff that are supposed to limit the false positives in that kind of scenario. But I do think the question raises really important questions around false positives. Because of privacy, you don't know whether you may have been wearing a mask the whole time that you were exposed to somebody, right? And you still get the notification. You may be vaccinated and still get the notification. I think these are challenges that we're going to have to work out operationally moving forward.
Yeah, and as I understand it, Apple and Google are doing their best to kind of fine tune this, but signal strength varies by device. It varies if it's in my pocket, if I'm going like this. And so there are
Right.
And one of the problems with not adding contextual information, or one of the limitations, is you can't then cross-check and you can't fine-tune because you can't then figure out that definitively it was a false notification or not, because you're not gathering that data. But that's to the end of privacy. Okay, one last question, just to reassure the manual tracers who are out there. It's very unlikely that CA Notify is going to take your job for all the reasons that Dr. Rudman and Reed, even if we got mass adoption. Is that correct?
That's correct. And actually, even if we had widespread GPS-based systems, I think that there is still a huge role for manual contact tracing, both because, as Aaron described, the difference of that backward look case investigation piece, which we will always need to understand where spread is happening, being separate from just notifying folks, plus the resource requests and the added benefits that come with that notification when they're done manually. And then finally, folks like Mike and myself are constantly trying to predict what next month and 6 months from now will look like. But as our case rates drop and as more people are vaccinated, doing a more refined level of contact tracing, where we treat people differently based on vaccination status and start to take into contact even lower risk exposures, are going to mean that those algorithms we set to understand who's exposed are going to have to evolve faster than maybe some of these apps are going to be able to do so. So yes, we still need our contact tracers.
All right, right on time. I want to thank everybody. I learned a lot from this discussion. I'm really looking forward to the next panel as well. I'm giving it back to Mike Shapiro. Thanks, everybody.
Thank you.
Great, thanks so much, Mike. I think that was a really great conversation that you had, and everybody on the panel, I think, had just some really good contributions. It's been just wonderful to kind of see your dynamic as well. And hopefully I think everyone got a little something out of that. Right now we're going to go ahead and take a 5-minute break to allow everyone to kind of stretch and also get our next set of panelists online. So I think it'll be a really good conversation coming up. So please stay tuned. It's going to be on the privacy impacts of modern contact tracing for future pandemic response. Okay, everyone, we'll see you in just a few minutes. Thanks. All right, well, welcome back, everyone. We'll go ahead and get started again. So now that we've discussed some of the fundamentals of contact tracing to provide a primer on traditional and new approaches, we'll go ahead and move into our second panel covering privacy impacts of modern contact tracing for future pandemic response. I can say up front that in the early days of this pandemic, many jurisdictions found themselves overwhelmed with new threat that grew by the day and the race to manage it. While we have all been attempting to learn and address this current crisis, we have had to essentially build the plane while flying it, a tall order for any organization and community, and even the stress that goes along with it. To make sure we learn from our experience from COVID-19 so that we can better be prepared in light of future pandemics, this panel will now take a forward-looking perspective that aims to improve outcomes through leveraging the utility newly developed contact tracing apps may provide, while preserving personal privacy in a way that builds the public trust necessary to bring people and communities on board. I'll provide brief introductions for our second panel and then hand it over to our moderator. So for this discussion, Professor Deirdre Mulligan, who's with the University of California, Berkeley School of Information, will serve as our moderator. Her research focuses on the intersections between law, policy, information science, ethics, and data science. She's a faculty director of Berkeley Center for Law and Technology, and before coming to Berkeley, Professor Mulligan helped found the Center for Democracy and Technology. We also have Dr. Brandy Nanecki, founding director with the Citrus Policy Lab headquartered at UC Berkeley. Dr. Nanecki has expertise in information and communication technology policy and internet governance. She studies human rights at the intersection of law, policy, and emerging technology, with her current work focusing on fairness, accountability, and appropriate governance mechanisms for artificial intelligence. Her research has been featured in Wired, NPR, BBC News, MIT Technology Review, and BuzzFeed, among others. Brian Hoffer is the chair of the Oakland Privacy Advisory Commission and the chair of the Executive Director of Secure Justice. His advocacy has been instrumental in a number of nation-leading ordinances, including ones that establish a vetting framework for the potential acquisition and use of surveillance equipment, and the first ordinance prohibiting San Francisco's use of facial recognition technology. And finally, Steve Penrod, Vice President of Product Development at Triple Blind. He has been creating software since the 1980s. His career spans a variety of roles at several different companies, including Autodesk, GNS Healthcare, and Mycroft. These all came together to help defend against the COVID pandemic, with his work developing the free and open source PathCheck digital contact tracing app and Privacy by Design services. So now I'll go ahead and hand it over to Professor Mulligan to lead our second panel.
Thank you so much. It's a real pleasure to be here. I have deep connections with many of the people who are leading this work for the county, and I'm really, really pleased that you are using your role as leaders to help us reflect on where we are today and where we might want to be as we move forward in thinking about digital infrastructure and its role in public health. So the panel, our second panel, is focusing on the privacy impacts of modern contact tracing for future pandemic responses. We have a really terrific panel, as I think you can tell. And I'm hoping that we can focus a bit on the role of the private sector in public governance, right? We heard on the first panel that much of the infrastructure for digital contact tracing is now not being built by government for government, but being built, at least in part, the infrastructure, some of the technical decisions that affect data flows in the private sector. And so this question of who sets the rules and how the public participates in them and how they're informed. The role of technical standards generally and the policies of private companies. I'm hoping we can also touch on expertise. We have a nice mix of people with different backgrounds on this panel right now. And it's very clear that the role of privacy protection is being distributed not just among policymakers, but also about people who build technical products and artifacts. And how we think about that. I'm really interested in Brandy's thoughts as an educator, Brian's thoughts as someone who's been overseeing efforts to think about the surveillance implications of technology used in city government, and on Steve's perspective as somebody who builds systems throughout his life. And I wanted to open with this question about like, what is the threat model? When we're thinking about, apparently my dogs have just shown up. When we're thinking about privacy, right, or security, people often have a threat model in their mind. And in the context of public health, there's both opportunities, right? We have this deep desire to support the health of the public. And you know, that always is requiring, at least at the margin, some creating tensions as we seek to maintain public trust and public participation, and encourage people to engage in these other regarding activities. And, you know, we've been dealing with the deep problem of public mistrust when we talk about things as simple as wearing a mask. And where those activities by design are aimed at protecting the best interests of the population, sometimes they require some proportional intrusions on the rights and interests of specific individuals. And so I was hoping that you could talk a little bit about kind of privacy threat models and the way in which you see them informing the design of the digital contact tracing technologies that we're looking at today. And I thought I would open with Steve.
Hi, thanks for leading the panel, and pleasure to be a participant here today. I think this was a very unique opportunity, and hopefully it remains unique in our lifetimes, to analyze what happens when we're looking at something that is truly global. And as you said, the threat analysis when you're dealing with something that is impacting, the massive population is significantly different when you're looking at a technology that's only being used within a small population, within your own home, within one business. And thinking about how these technologies could be used has to be considered with how they could be abused. And when you are literally tracing every person on the planet, there are going to be people of interest to different parties. There is, as we all know, bad actors around the world, and we have to think about, put ourselves in the shoes of those bad actors and try to think, how can you make these things that are built for public good to be used for something besides that? And at the core of the designs, you can then, when you put yourself in that mindset, you can then be certain that what you're recording and where you are recording and how it is being recorded, if that became available knowledge, and assume that at some point it is going to be broken and it is going to become available, how could that be abused? And if so, how can you not record information so that it could be abused in those ways? And that was one of the things as we were building up the designs for the path check application that we focused on, is making sure we don't record things we do not need at times we don't need it.
And Steve, could you talk a little bit about your process of design? Who is leading it and who is involved, and why did that matter from your perspective?
Sure. Of course, this was an interesting team that sprung up almost immediately, and we had the advantage of my prior work, my company that I'm working with, Triple Blind. We are focused on how to perform and how to work with data in a deep way, but retain the privacy of it. So we had sort of a leg up on what we were attempting to do here. In conjunction with that work, we'd already been working with the Mayo Clinic and with Professor Ramesh Raskar at MIT. And that's really where all of this sprung up, is, we had the right group of people who had the right background and had already had their thoughts and their heads into these thoughts of how can you work with data in ways and preserve the privacy while still extracting the information, the answers, or having a process that allows you to get the things you need out of it. So we really, it started with just a couple of us basically in a room at MIT while we were working through this, figuring out how can we design and architect and allow the data to flow in ways where there was not a centralized, and that was a very big piece for us, is coming up with a way to have decentralization which is a good way to protect privacy. Whenever there is one place with information that has problems potentially, and there are times to centralize information, but there are things that we wanted to avoid, and we inherently avoided by not storing those things in one database in one place.
So Brandy, I would love to hear your perspective. Steve was just talking about a particular design choice. I know you've been looking at the emergence of contact tracing apps and other sorts of technology that's being used in the pandemic setting. And I would love for you to talk a little bit about your perspective on some of the designs that you see emerging, and kind of both the limitations of those designs and the relevant policies that you view as kind of needing to partner with particular technical choices.
Great, thank you for that. And it's so nice to join you, Brian, Steve, and Deirdre, thank you for organizing. In the chat, I've just put in a report that was authored by a graduate student at UC Berkeley working with the Citrus Policy Lab named S. Freeman. And in that report, we went through 4 different categories of technologies that have been deployed to help mitigate the spread of COVID-19, including exposure notification and digital proximity tracing, which are probably the most common. There's also aggregated location data. I heard in the last panel talking about GPS, also symptom tracking and immunity passports, which I think are going to become, I don't know if more prevalent, but there's definitely going to be a push for more immunity passports as people get vaccinated. Before we talk more about the benefits and risks of each of these types of technologies, Mike Shapiro, when he opened up our panel, made a really excellent point that essentially we were building the plane while we're flying it. And if we're doing that, then we're, I think, prioritizing risk mitigation strategies rather than benefit optimization, right? We're just trying to survive day to day as we're building these out. And if we bring this also to the idea around appropriate governance mechanisms, we've seen at the federal level that they introduced legislation specifically focused on data privacy for contact tracing in relation to COVID-19, which while it's noble, I think it's an inappropriate focus. Instead, what would be more appropriate, I think, is stronger data privacy legislation at the federal level that can help us better navigate how do we appropriately operationalize principles of privacy and security in a technical way into the tools that we're developing. So I'm hopeful that from the experience that we've gone through during the COVID-19 pandemic, we'll better ensure that we have the appropriate governance mechanisms in place and technical strategies for the future pandemic.
So Brian, the Oakland Privacy Advisory Commission has played a really important role given some of the gaps at the federal level and even at the state level around privacy protection. And I'm wondering, what can we learn from the work that OPAC does and for the surveillance ordinance for how we think about bringing technical products into government work?
Yeah, and thank you, Deirdre, and thank you, Santa Clara County, for having me here. There are so many great observations and concerns raised in the first panel, and what I haven't really seen, domestically or overseas is a framework to really vet this, to get public input, to get community buy-in. And I think trust is maybe even more critical in this context than the privacy impact of these apps. And what I like in Oakland, and it was actually pioneered in Santa Clara County, Supervisor Simidian sponsored a surveillance technology framework in June 2016. It requires an upfront analysis. You figure out these things before you go release this out into the wild and, figure out that we didn't mitigate our risks. And then we lose more trust. It sets us on our back feet, and we've got to do, an even harder job to get the community to maybe adopt an app or to participate in these programs. And when you were on the commission with us, Deirdre, you saw, we had a pretty big variety of proposals. There might be one that's just solely limited to law enforcement, but we also had a number of private vendors coming to us for, parking analytics and homeless outreach and other things. And so I think the model that we have in the Greater Bay Area now is versatile enough. It creates a public forum to not only increase transparency, but to give the people a say. And I think the private sector could participate in that. It doesn't, just to be government side, the private sector should be there or adopt this same model to allow the community to have some input into design and the guardrails that are put into place. It's been working well in practice.
Yeah, so one of the things that I think unites the conversation that we're having here is this concern that governments are procuring technology that embeds many policy choices, right? What's our privacy threat model? What's our security analysis? How do we think about bias, which I know is an issue that's been very important both to the Oakland Privacy Advisory Commission as well, Brandy, I know in your work, thinking about the haves and have-nots and how the digital divide might actually contribute to a public health divide if we're not careful. And I think one of the things that is super interesting about the innovations that have happened in the Bay Area that Senator Smith, now Commissioner Simitian has played a leading role in is this use of impact assessments to create a forum for public participation, bring in different kinds of expertise, question things like the role of the private sector in determining technical infrastructure that's going to be playing an incredibly important role in public life. And I'm wondering, Steve, from your perspective, it sounds like you didn't have a venue like that to go and vet the development of SafePath, which is now PathCheck, is that right? And I'm wondering, like, if you had, how do you think it might have changed the way in which the app development process happened?
Right. Yeah, we were, as they said, we were building as we go. And as a result, I have previous experience in building open source communities. Mycroft was an open source voice assistant. Privacy was obviously a concern in that world. And one of the best ways to, expose yourself to scrutiny is to do things like open source and to have things. One of the pieces that I believe helped PathCheck develop and grow from, literally 2 people to thousands of people in the course of just a few weeks and months, was that we opened ourselves up in not only our source code, but in our communications tools. So we built Slack communities and had an open Slack community and have people joining from all forms of, everything from government participants to research and education, to medical participation, to private individuals who just showed up, especially in this case where suddenly the world was frozen. There was a lot of talent that knew they could help. They just didn't know how to help or where they could help. And when they found something like this, that allowed them to jump in and whatever their particular set of talents are, whether they're security audits, whether it's UI and UX development to make it accessible to more people, or translation so that you have it not only in one language, but you have an application that can be used in dozens of languages, or potentially every language in every location. The other piece that we really were aiming, because we knew the urgency of what we were facing as well as the challenge of what we were facing, is building it so that it was not tied into one infrastructure. It was not tied into one organization, but building a piece of technology that could be repurposed and reused by different jurisdictions, different countries, different cities. That was a very important key piece that I think was a differentiator and should be thought of when we're talking about emergency situations where you don't have time to do as much planning. And we can do some pre-planning, but we do need to figure out a way when facing, by its nature, something unanticipated, how we can rapidly iterate in ways that are effective and ethical. And as you said, does not lose the trust of the people you are serving as a public agency.
Yeah, one of I think the really astounding and kind of hopeful things that we saw during the pandemic is people really rolling up their sleeves and jumping in. And we've seen people developing open source medical supplies, masks and gowns, and a real investment by the maker community. And obviously even by large tech corporations to try to figure out how they could assist. And I think there are both really positive elements to that. And then I think it raises this question of who's driving and who's setting policy and where that coordination is happening. And Brandy, could you talk a little bit about what you view as kind of the strengths of the things that have arisen and some of the problems, and how you, as somebody who's thinking about policy, would like to see things change or carry forward?
Yeah, happily. So actually, I have a question that I'd like to pose to the other panelists off of this issue. Deirdre, you brought up the good point about governments are increasingly doing these kind of risk assessments when procuring technology. And I'm very curious if there has been a risk assessment methodology developed for these types of tools. And if there has been one developed, is it being implemented? What's the process by which government entities are going through when they're evaluating these tools? And I'll just say that I think, for better, for maybe for worse, I think that there's this knee-jerk reaction to turn to technology to save us during times of uncertainty. And I think that that is likely going to cause more harm than good. So I'm very curious how governments are implementing sort of a cost-benefit analysis before adoption.
So I think to kind of veer into another, controversial topic that touches on privacy and security, I think we've seen that in many instances, very similar to what we saw in kind of the use and adoption of contact tracing, in the adoption of facial recognition technology, right? Lack of coordination, lack of assessment, right, by governments in a kind of thoughtful, participatory way about the policy implications, and a belief that any marginal increase is going to be better without necessarily considering the cost to trust, the potential biases, etc. So I think at a meta level, there are communities that I think are doing this well. And I think, we can look at Santa Clara and Oakland as places that are standing up infrastructure to do this sort of work in a detailed and meaningful way, but raising real questions about available expertise and budget and time, right? We're asking people to do, most people haven't done a privacy impact assessment or a surveillance impact assessment. And we don't necessarily have a deep enough bench, I think. And I think this goes into some of the kind of renewed effort to build people with interdisciplinary backgrounds who are interested in kind of public interest technology, and both on the build side and on the policy side can help us figure out how to do better as we go forward. But I think the kind of pause that we've seen on facial recognition is a bit of a wake-up call about some of the real costs of not doing that thinking ahead of time, right? And so I think that the efforts at Santa Clara, the efforts in Oakland, Seattle, and other places are really important because I think in many ways they're experimental. And then of course there is the requirement at the federal level for privacy impact assessments where federal government agencies are adopting technology. But we have this interesting thing where here, right, many public health interventions, they happen at the local level, they happen at the county level. And so the importance of this local infrastructure, I think, becomes even more important. And Brian or Stephen, would you like to jump in?
I'll just say that in the Bay Area is very weird in December and January to be getting calls from overseas asking for guidance. And I'm like, what is COVID? I don't even know what you're talking about. And they're so used to the Bay Area and, Oakland being a leader, Santa Clara, the heart of Silicon Valley. And so I really appreciated, and there was a number of the folks on the first panel, Brian Ray reached out and said, hey, do you think this could be vetted by your surveillance technology ordinances that you guys have in the Bay Area? And Aaron got involved, and Mike and Deirdre jumped in at one point. And so we were going to try to craft, basically like a case study, running the MIT app, I believe was the one we chose. through our framework. And you know, that's still in process. We realize is a very big project, but I do think the Bay Area procurement ordinances, the technology vetting frameworks, they work. They force you to ask the questions, which, you know, we heard on the first panel, to address those, to put your privacy assessment together. And I think this is a model that could be, you know, replicated, that would have prevented some of the harms we've seen in, you know, like the North Dakota rollout and so on. We wouldn't have had those oversights if we would have asked the questions in the first place.
Yeah, and I want to kind of build on something that Brandy said. When people try to jump to technology as a solution for problems, you know, ultimately, it's very rare that that is the case. What technology is a tool, and it's augmenting something that people are already doing. In particular, in the digital contact tracing technologies that we developed, I, you know, was literally interviewing contact tracers. What do you do? How do you do it? What information do you want to get? And it boils down to nothing that we created was unique. It was producing something that they were already doing in a way that's faster, that's more accurate, that's less error prone, and that would help them do their jobs. And that's got to be, you know, when you have something that you're trying to build out, if you're trying to build a whole new way of doing something, you're going to make mistakes. But when you're augmenting something that already exists, and when you're in an emergency situation, that's the sort of thing you can do that can help with technology. You know, trying to create from scratch something to solve an emergency that's never been done before, that's likely not going to work. And it's just going to be a waste of valuable resources during that kind of an emergency.
Okay, so I want to dig in a little bit on privacy threat models, and both on the first panel and I think here, and you know, the CDC, there's a host of places that have really emphasized the importance of decentralized models. Hold on just one second, sorry. Sorry, little family noise in the back there. So on a real emphasis on decentralized models. And on the first panel, I think we heard some concerns about the way in which many of the contact tracing apps frame the government as the threat. And in doing so, limit some of the information that contact tracers normally might use to engage in public health protecting activities. And I think it's interesting, you know, privacy isn't about anonymity. I know everyone here is aware of that, but rather, as you know, Helen Nissenbaum has really forcefully and compellingly argued, about appropriate flows of data, right? Data is supposed to flow in in a sphere of social life in a way that supports contextually appropriate activities. And as I mentioned earlier, right, public health always poses at the margin at least some tensions. And the best interests of the population, right, at sometimes require intrusions on the rights and interests of individuals. And there's some interesting lessons that I think we can look at in the history of kind of HIV contact tracing, which eventually became renamed as partner notification, and then later on actually became kind of rebranded as partner counseling and referral services. And the importance there, I think, is that contact tracing was like an element of the process that opened a door, right? Because when somebody was being notified that they might have been exposed, they were provided with counseling and testing services and treatment and linkages to medical care. And thus, you know, it nests the identification of risk of a health issue with information about services to ease the cost of taking protective measures, right? And if individuals are unaware of the resources that it can assist them, right? The housing or food assistance, the job protection, the healthcare, the protections against discrimination. They're going to be less likely to act in ways that are beneficial to them and to society, right? They may avoid testing, they're not going to act on the information. And the models that have really, I think, dominate right now really limit the availability of information to public health officials in ways that I think make it really difficult for them to kind of nest and provision all these other services that might be really important for people if we want them to engage in activities that are protective of the public's health. And I was just looking for some reflections, that model of government as risk is very much driven in I think by a kind of tech sector, civil liberties, libertarian orientation. And I'm not sure that anonymity is always the right answer when we're thinking about public health interventions. And I'm, wondering what you thought listening to that first panel about some of the particular costs of the way in which privacy is being modeled in many of these apps. And I guess I'll start with Brandy.
I think this is an excellent question, and it harkens back to what we said at the beginning of the private sector, sort of setting the standard of what is meant by privacy. I'm actually very interested to hear the practitioners like Steve, Brian, you individuals who have worked on implementing these technologies. What data do you think should be included in contact tracing apps? Do you feel like the data that's being collected now is appropriate for you to be able to adequately address the spread and engage in contact tracing efforts? Is there additional data that you think should be collected? So where do you guys draw that privacy line?
I think when we were first looking at how to do this and how to augment what a contact tracer, a traditional contact tracer would do during that interview, we jumped to immediately GPS information because location was a key of who did you see. It boiled down to the location. Pretty quickly, we also, it had evolved the idea of Bluetooth being a way of knowing proximity, who is near you, without even necessarily knowing location. There are situations where each has an advantage over the other because of technology limitations. If you're inside of a building where you can't see the GPS signal, then you get a reading, but it's not necessarily a correct reading. Or with Bluetooth, if you're, just the other side of a wall, you may not get the Bluetooth signal of another phone, even though you're sharing the same air through the circulation. So finding the right technologies and having the right information recorded is important, as long as, and especially if you do your design so that you're recording as much information as possible in a distributed fashion, where the individual, what we designed specifically on the person's cell phone, that's where all that information was stored. And until it was needed, it was never taken off of their cell phone. And our real definition of need is exactly what would happen during a contact trace interview. You're in a private conversation with that contact tracer. You're aware of what's being shared with that contact tracer. You're made aware, so that the individual is granting explicit permission to share information with that person. And it's not something that, I think people fear that they are being surveilled by someone that they don't know. And that leads to the public trust issues where people, when they are surprised, that's when they get defensive. And that's when they start thinking, what else might be going on that I'm not aware of? And so the more explicit and the more direct permission that you work with people without making it a burden, that helps build the trust, which helps allow us to put out systems that are going to help people.
Right.
Yeah, and this gets back to, I think, your very first question, Deirdre, is how do you come up with a threat matrix for something that affects the entire world, all sectors of our economy, and every single person you pass is a potential threat? This is a very hard question to answer right now for me, because I haven't seen a complete package, a proposal that seems to be considering all the different components. And I think if I understood your premise correctly, I think the biggest missing part is we're not involving the public in those decisions. What their comfort level is, what types of data they might think. Certainly you need the subject matter expertise to inform those decisions, and the private sector's got to tell you what's even possible in the first place. But I'm cautiously optimistic that this type of technology can work. I don't think manual tracing can keep up with something that's so infectious. But I don't see a lot of effort being made to get the public trust and the public input. And so I think part of your earlier question is, or your statement was that, we're seeing the government as the threat in our threat models. And well, there's very legitimate reasons why. And we're not doing what I haven't seen, like anybody really taking concrete steps to mitigate that. And I'm very pleasantly surprised and impressed that the private sector is really looking at the privacy aspect. But to me, that's just a more minor concern here, which is strange as a privacy activist to say. But without trust, I don't see this proposal working at all. And that's the part we've got to fix.
If I could push on Brian's comment here, I actually want to ask you a question about, well, what do you think government should be doing to build trust? What actions should they be taking in light of what we have learned during the COVID-19 pandemic?
I think a public forum, a public, feedback is necessary. And that's what's been great about having the Privacy Commission in Oakland. San Diego is going to follow us here very soon. They're just waiting on the second required vote for their ordinance. Oakland is toxic. There's a lot of distrust. Our police department's been under federal oversight for 18 years. But when the Privacy Commission blesses something, people calm down. It takes away that suspicion. People know that we've vetted it properly. We don't miss things that are going to have a big negative impact later. And so I think the government should be going out with the private sector, and whether it's a workshop, a Zoom panel, I guess will probably be limited, during COVID, but you got to start talking to the public. There's a large, and not just the fake news Trump people. There is a large sector of the community that does not want to adopt these apps and does not trust that we're going to handle the data responsibly. I think informed consent has been another missing piece. We knew there was only going to be a matter of time until law enforcement started seeking the data, and we've seen reports of that. And so those types of discussions, I'm just not seeing them happen.
So Brian, that brings us kind of back to kind of the threat model question. And a lot of the, if we place I think about my own data, right? Not contact tracing data, other data. Is it safer locally on my computer? Is it safer in the cloud? What are the risks I'm concerned about, right? My capacity to secure my machine is not equivalent with any of the cloud vendors' abilities to secure their data centers. Of course, I'm hoping my machine feels like a less meaty target. And so perhaps there aren't the millions of attackers coming after my machine every day, although not really sure because I don't go through my logs. But when I'm thinking about like privacy risks, if my concern is with my employer demanding to see whether or not I've received a notification, or I'm concerned with my housemate telling me I need to install it and they want to be able to see if I've been notified, or we're concerned about law enforcement demands for these information. These are not things that the technology companies can address, right? And so I'm wondering if we could talk, some of the issues that I think, Brian, you were highlighting are things that require government action, right? We can't just say, oh, let's leave that to corporate policies about, how data is used. And we've seen, the EEOC, OSHA, there have been some guidance put out about contact tracing apps, but they are very deferential to kind of have rules in place, right? They're in the private sector, they're not kind of setting the rules themselves. And so Brandy, I'm would love to hear you a little bit, and Brian a little bit about what rules do you think we need in place to make an environment where people do trust, where people do want to use technology, masks, right? And the public health interventions that we know from the experts are going to advance our collective interests.
Yeah, this is a really good question. I think, especially around contact tracing apps and the data collection, we need stronger rules on data privacy considerations. Of course, we have the California Consumer Privacy Act, which has set some of those guidelines, around data minimization, collecting data for specific purposes, consent, user consent to the collection of that data. So I think that's a very promising step. I'm hesitant to think that we need specific rules just for contact tracing or for pandemic technologies. Instead, I think it's more sound to have rules in place that can govern different applications of technology. So I think there's a lot of work that needs to be done moving forward. But I also think part of that work is ensuring that we have a robust discussion with the public on what their concerns are. I think sometimes that there is, privacy issues are overblown, that, everybody wants to just say, let's make sure everything's private. Well, does it really, does all the data need to be private? Where do we draw the line of what's appropriate data collection and sharing and actually puts communities at risk versus just an over-encompassing view of everything should be private? So I think this has really revealed that we need to have more of these discussions to inform appropriate oversight.
Yeah, I'd like to jump in, that trying to create, the perfect policy, trying to create the perfect set of rules and limitations, you're going to end up either limiting to where you can't achieve anything at all, or more likely you're going to miss the mark and you don't think about some human behavior, some human social thing that occurs based off of what you created when you first created that policy. So I think, again, trying to come up with ways where we can iterate. The private industry, private sector has adopted agile methodologies because iteration comes up with a better thing than the waterfall approach of planning everything first and then just executing your plan. It rarely works out. You've got to take every step and evaluate as you go through those steps and adjust your plan as you go. And that requires iteration, which is sort of tricky when you are talking about, areas that are governed by laws. And once you've placed a law, that is sort of a hard line you don't get to cross again until a very painful process. So how are we able to establish policies and procedures that are flexible enough that we can do iterative approaches to these things as we're developing new novel technology?
Yeah, and I like both of those comments, and I think I do agree. Like with what Brandy was saying, we don't necessarily need new or specific, COVID laws. We do need stronger data protection laws. I don't think, partly I think Steve was sort of making or raising a concern about just maybe not anti-innovation, but just, the slowness of government bureaucracy. I don't know that we necessarily need a top-down federal one-size-fits-all policy. It would be nice to have federal leadership on this issue for once, but I don't know that we need a one-size-fits-all policy. But I do think our existing Bay Area model, the impact analysis is accompanied by a proposed use policy. That's where we set the rules in place. It's at the same time. The impact analysis should be informing your rulemaking, and you have that public conversation at the same time so that there's some public input and hopefully buy-in. That gets back to the trust part. I do want the government in the driver's seat. Despite my last 6 years of activism fighting, state power or the abuse of state power, and my concerns, about law enforcement, at least we have oversight. We have transparency. We can hold people accountable. And so I think if we let the private sector drive this and just say, well, maybe look at our model, but you guys just take it, I think we lose maybe the accountability component. And that is important when we see data breaches. And to get trust, people have to know that we can hold the people, the folks responsible accountable. And that's a lot easier to do on the government side than the private side. And most of what I've seen to date, the apps would be running through a public health authority. I think that would give people a little bit more sense of trust than a for-profit corporation, maybe holding this decentralized data. But I would hope in under either scenario that there's close collaboration between the public and private sides.
Yeah, I'd like to toss in on that too, that I think one of the hindrances to the early days of the COVID response was the fear of liability. Technology organizations were looking at their potential liability and building something global. And so that resulted in pulling back from certain things. And I think it's especially tricky when you are talking about really, multi-jurisdictional at all levels, not only counties, cities, states, nations in that case. And really, where does the liability lie when you're talking about something, even if it is located in your county as a company? How do you deal with giving them, permission to develop something under the appropriate oversight without them taking on fear that they're about to, create a $1 billion lawsuit? And had there been some form of protection, framework that had existed, I think it would have assisted us in launching this sort of technology faster and developing these sorts of things faster, and being able to even do small examples of research, at a county or a city or even, a university level. It's very difficult to do right now because of basically, as a private company, they worry about shareholder and liability concerns, and without government guidance and systems in place, which I don't think they even exist even at this stage, this is going to be an ongoing problem. And that's the sort of thing that you can look forward and you can prepare for. Even if you don't know what it's going to be, you can help those frameworks by creating those frameworks.
I just want to jump into, thank you, Steve and Brian. I think that one lever that can be pulled is around procurement, government procurement, and setting guidelines for considerations before technology can be procured. And I think that the work being done in Oakland around risk assessment, privacy assessment, this should be built into the procurement process. Are the companies taking the appropriate steps in alignment with our risk assessment framework to mitigate those risks? And I'm curious if that has been developed into your procurement process. Like, how are you tying together the surveillance privacy assessment with procurement rules?
It's all interlinked. Basically, the first sentence of this model ordinance is city staff shall not go acquire XYZ technology without city council or governing body approval. So you don't get to go get it until you come through our process. And that's where I hope we can get, and this is all over the country now. I think there's about 20 when you consider what's in California and outside California. But you bring that proposal to us. You've got your analysis. It's going to inform the policy, the rule setting. And ideally, we're going to mitigate all those risks up front because we have that informed discussion. And it's a blend of subject matter expertise. You know, we had people like Deirdre to guide us, but also the public. You know, they deserve a bite at the apple. The transparency leads to greater trust. And then, you know, under our existing Bay Area models, we also have an annual reporting requirement, which I do think, you know, reporting is something in this context is going to be critical, partly just the speed, you know, all these different virus variations we're seeing, just the changing, you know, hospital capacity numbers, all this stuff. There's a lot of data constantly coming at us that, you know, may inform a policy change. And so we need to be quick and adaptable to that as well.
Okay. So whether, you know, we're talking about exposure notification apps, I think they were framed on the first panel as a new tool to aid contact tracing rather than a displacement technology, which I think, you know, our conversation is as framed as like the right framing. It's always important to think about the way in which a new way of doing something, however, the function, right, is being redistributed. And we see there are now people who used to maybe be the people on the front line asking the questions and getting access to certain kinds of information, no longer getting that information, the public health officials. But we also see new people potentially getting access to information, right? So to the extent that employers begin requiring people to have apps and to use them, and to provide information about whether or not, for example, they've been notified that they've been exposed. We all of a sudden have these new entities, right? We have employers who might all of a sudden, are they the new contact tracers? Are we, like, how does this intervention kind of shift who has information? And how does that shift kind of the distribution of responsibility for protecting the public health? And what do we think about that? That's you, Brandy.
Yeah, I think that's an important consideration around who now has the burden of doing this. So I think moving forward, as we think through how we design and deploy these technologies, that, you know, this, it's really just thinking through who should be doing this, who should be setting the rules, what are the appropriate methodologies for setting those rules, who needs to be involved. And again, I keep like saying, Oakland, I think you guys are doing an excellent job of doing these risk assessments and having community input. And I think that this should be adopted in more jurisdictions.
Okay, so we don't have a lot of time left, and we haven't dug in too much to some of the questions that arose on the first panel around bias, right? Who's going to end up using the app? There's been some particular questions in the chat about also when we think about public participation, what are the biases and who shows up? Often we start thinking about making sure we have representative stakeholders rather than just relying on the public to participate. And I think, Steve, your development model was a little bit more stakeholder oriented rather than public participation oriented in the way you described it, more like user-centered design maybe, or something. I'm being generous maybe. But I was hoping we could talk a little bit about the concerns and possibilities when we're thinking about bias. And it may be like exposure notification is only one technology, right? And Brandy, you've documented a whole swath of other approaches that might give us better kind of population level health information. So maybe talking about the ways in which like composites of technology might be useful in addressing biases. But I think we had heard some real concerns about the ways in which like this re-architecting through exposure notification raised some concerns for public health officials about the ways in which that might target interventions or mask locations where they really need to deploy more resources, et cetera. And so if you could kick us off, that'd be great.
Yeah, I think also a risk here is that you might, because people won't use the technology, they might not have the ability to use the technology, then you have a void of data on those individuals. So then you can't allocate resources to them because you don't know that they need those resources. So I think first and foremost, there has to be a critical analysis of, if we're going to deploy this technology, who is likely to be disproportionately left out? And then taking that into account, what strategies do we need to put in place to better ensure that these communities can access the technology in a way that does not create an undue burden on them to utilize those technologies. And I know at the beginning you brought up the digital divide issue. I think that this is a huge issue. If we're able to have the deployment of the use of technologies to mitigate the spread of COVID-19, we had better make sure that everybody has the ability to equitably access those technologies. So I think that inclusion is critical. None of this works unless we have equitable distribution of these technologies. And then though, on top of that, I just want to point out though, that sometimes the use of these technologies may place an undue burden on certain communities where they feel forced to opt in, even if they might not want to. So for example, if you need to do symptom tracking in order for you to be able to go back to work, well, who's going to do that? People who have to work, who can't choose to work from home like many of us have been able to. And so I think whenever we're thinking through the technology and the data that will be collected, we have to think through, can everybody equitably access this? By deploying this technology or placing some requirements on access to services or to work, are we then creating essentially a mandatory requirement for certain communities to use the technology?
One of the things that we developed as we were building the technology, we were trying to be very cognizant of what it would take for people to adopt the technology, and working with groups. And for example, within Haiti, when we were working with them early on, it became evident that based on past experiences, there was distrust of outside organizations coming and offering assistance because of some of the responses they'd had to natural disasters, where there's this big splash of help and then everyone disappears and they're left holding the bag. And so one of the approaches we did there was, not only were we building, things in the private sector and with the government organizations that were going to be, pushing this forward, but also private organizations that were trusted amongst the community, who were participants in evaluating and vetting and then being able to put their voice behind, this is something that you can trust. We're speaking as a voice of the community, helping you understand what's available and why you should trust it. And then other things that are possible when you're looking at these problems and putting yourself in the mindset of an individual who's looking at adopting this and what's the cost of this in various ways. There are a lot of unique things and people are willing to participate. So again, in the Caribbean, where data transfer costs money, literally every single byte costs somebody some amount of money. And when you're looking at individuals with older cell phone technologies, they're probably looking at, every cent that they're having to spend on that. So some of the telecom corporations volunteered to, absorb that cost for these purposes. So there are a lot of ways to build these technologies, but it's not just the tech side of it. It's really, how do you pull together the community, and that community is everyone, all the organizations, all the businesses, all the governments, and all the individuals in solving these problems. And, I think that was one of the best parts about building the PathCheck organization was it wasn't focused on any one of those. It was really trying to pull together all of those groups.
So it's almost time for us to wrap up. I kind of want to give a shout out to all of you in the Bay Area in particular, which is often viewed as kind of the hotbed of technical innovation. But I think we have really learned from this panel that it is also a hotbed of kind of policy innovation around the responsible use of technology. And I think it's really important. The policy is often kind of latent and opaque, and the enabling role it plays in ensuring that we can use technology in ways that are meaningful and useful, particularly when we're dealing with something as immense as a worldwide public health crisis. Policy isn't a barrier, right? Policy is a way in which we enable. We enable the public to trust. We enable us to use technology and mitigate the downsides. We can enable technology in a way that is useful and fair and inclusive, rather than in ways that perpetuate systemic bias. And technology and the private sector can't do those things on their own. And so I just want to thank all of you for kind of contributing to the advancements of how we think about building technology in a way that serves society. And I'm going to give you each just a minute for some closing remarks. Why don't you kick us off, Brian?
Great, thanks. Yeah, I just want to encourage everybody to, all the questions and observations that I heard here were extremely intelligent and on point. And I think just the missing component is how to execute these and to get greater public trust and buy-in. Because I think most of us agree that's the only way this is going to work. I appreciate those comments at the very end. We didn't even really start talking about like stigma, but that's also sort of part of the equity conversation. Those questions aren't being addressed right now. I think it was the UK study. They're saying that more than 3/4 of the phones couldn't even use the Bluetooth technology. We've got to address all those big questions before we push this out in order for it to succeed. But I do think we've got the people that can make it happen.
Randy?
Yeah, I want to go back to the point that Mike Shapiro made at the very beginning around we're actually kind of building the plane while we're flying it. And I think moving forward, let's try to mitigate that. There will again be situations where we're blindsided by something and we're going to have to respond quickly. But what we're seeing being developed right now are frameworks that I think can be scaled to different domains. So I just am very encouraging of the work in the Bay Area to develop these more participatory models of governance. And I think that they're critical for moving forward.
Steve, the last word.
A year ago today, I had no idea what contact tracing was. I had lots of experience in lots of different areas, but like many people, this came on rapidly. And, I have to say that I'm encouraged by how many people were willing to jump in, how many organizations, how many people at all their different responsibility levels were willing to help each other. I am disappointed in some ways that we weren't able to do more this time, but I'm encouraged that we now understand some of the mistakes that we made, and how we react today is going to make it easier so that we don't have those roadblocks or don't have those sorts of repeated mistakes. And, I hope that right now, even though we're still in the midst of COVID and knocking that down, we are able to, before we forget, put these things in place.
Thank you all so much. And I'm going to turn it back over to Mike Shapiro.
All right, well, thank you for that interesting discussion. And I have to say, it's been wonderful to hear from all of our speakers, panelists, and the great questions from our audience. As we wrap up today's event, knowing that we still have a ways to go in dealing with the pandemic of an era, I'm amazed by just how much we've learned and how far we've come in a single year. And I think Steve really touched upon that very well. So if you think about it, just a year ago, most of the public had never heard of COVID-19 or thought about how our world was about to change so radically. And you can see how much progress we've made in such a short time. The good work so many of you are performing should give us all hope as we think about how to prepare ourselves in the event for future pandemics and how we can keep people safe. That's ultimately the goal. So for the public health community and government, we can see hope in these new technologies that can help us better contain disease if leveraged in an equitable way. For technology developers, we've seen you attempt to drive innovation to do your part in this collective effort. And to serve the public, we've seen the need to continue to make sure the privacy is baked in throughout these initiatives to help foster that trust, so all of you may feel more assured that technology can be designed and used in a responsible way to address public health moving forward. So on behalf of the County of Santa Clara Privacy Office and the Office of County Supervisor Joe Simitian, I hope that everyone has enjoyed this event today. We do have a short survey that we'll send out afterwards, anonymous of course, and special thanks to all of those who contributed to Data Privacy Day this year. We look forward to having all of you join us next year, hopefully in person, at least for those of you in the Silicon Valley area, and virtually for others. So thanks everyone, stay healthy, and we'll see you later. Thank you.